Thank you, everyone, for being here today. Thank you to Attorney General Andrea Campbell for joining us as well, alongside our Secretary of Health and Human Services, Kate Walsh, Public Health Commissioner, Dr. Robbie Goldstein, our Secretary of Labor and Workforce Development, Lauren Jones, healthcare leaders, including Steve Walsh of the Massachusetts Health and Hospital Association, Michael Curry of the Massachusetts League of Community Health Centers, advocates for our dedicated hospital and healthcare workers, including Julie Pinkham of the Massachusetts Nurses Association and Tim Foley of SCIU 1199. Healthcare for All's Amy Rosenthal is also with us here this morning. And in this room, I see many more patient and community advocates, among others. Thank you all for being here today. We're here this morning because very early this morning, Steward Healthcare moved forward with a national bankruptcy filing. This bankruptcy is something that our administration has been preparing for. Steward currently operates 8 hospitals in Massachusetts, which collectively employ 16,000 people and serve 200,000 patients annually. I want to be clear. Steward hospitals remain open. Patients should keep your appointments. Continue to seek care when you need it at these facilities. I want to repeat, hospitals are operating as usual. And the Department of Public Health remains on site at these facilities to ensure that they are providing the highest standard of care that all Massachusetts patients are entitled to. In addition, Steward is taking steps to retain providers and staff as we are engaged with all of them working to make sure that happens. I want to say how grateful I am to the nurses, the doctors, staff, and others working at these facilities. Men and women who come to work and have come to work, and I know will continue to come to work each day, focused on providing excellent care to our residents and patients in need. Now, last week, we announced that our Department of Public Health had activated its Emergency Operations Plan. An incident command system is now in place to organize efforts to ensure that Steward hospitals and regional healthcare systems are maintaining quality care and services. Moving forward, the purpose of a Chapter 11 bankruptcy filing is to provide an orderly way to deal with debts and liabilities, and to potentially transfer ownership while continuing to operate and serve patients. Ultimately, this is a step toward our goal of getting Steward out of Massachusetts. And it allows us to do that, to protect access to care, preserve jobs, and stabilize our healthcare system. Of course, we cannot guarantee that there won't be disruptions or inconveniences. And I understand that members of the public are concerned about what this means for them and their families in terms of accessing care. But that's why I want to be very clear in telling the public that these hospitals will remain open and folks should continue to keep their appointments and seek care as needed, including if you need to see an emergency room. Our commitment from this administration is to be open, transparent, and responsive to our communities every step of the way. For that purpose, we will have information and resources in place for patients, for workers, and for community members. Secretary Walsh and Commissioner Goldstein will share more about those steps. I don't want to lose sight of the fact that this situation stems from and is rooted in greed, mismanagement, and lack of transparency on the part of Steward leadership in Dallas, Texas. I've been clear about that. I'll continue to be clear about that. It's a situation that should never have happened, and we'll be working together to ensure that there are steps taken to make sure that this does not happen again. But the focus for today and in this process is protecting healthcare, protecting workers, protecting patients, protecting every community that depends on our hospitals in Massachusetts. This has been and remains an urgent priority for me, our entire administration, and all of our partners. This is a national company and a national filing. We will be advocating aggressively for Massachusetts' interests, the interests of our patients, our consumers, our workers, and our communities throughout this bankruptcy process. As you can see today, we are all unified in that commitment to advocating for Massachusetts. A strength of this great state is our ability to work across government, across sector, to align on values, and to come together in partnership when we need to act. And that's what you are seeing today. And it is the dedicated nurses and doctors and all healthcare workers who show up to work every day to care for patients with skill and compassion, and we thank them. We are committed to using our shared values and combined energies to protect and ultimately to strengthen healthcare in Massachusetts, as this provides an opportunity to do just that. We're grateful to have in place experienced hospital and healthcare leadership, people in critical positions, and I in particular am grateful to Secretary Kate Walsh and Commissioner Robbie Goldstein for their work.